right, good morning, everybody. 8:35 a.m. Pacific time. We are August 3rd, Saturday. We're going to talk about veterinary oncologist, and probably the next couple of days I'll talk about different specialties and what a pet owner can expect when they may have a consult with said specialist. So, oncology is the study of cancer, and they're very, very busy in terms of having appointments set up for them for oncology consultations. Your veterinarian will set the groundwork in terms of preliminary diagnostics and then confirming or suspecting the diagnosis of cancer in your dog. Doesn't really matter what kind of cancer, but anyway, they will diagnose the condition. They're going to also, your family veterinarian will also try to stage your dog. Staging is determining the extent of disease in the body. So, is the cancer in only one location or multiple locations? And that information they're going to try and collect before they send you off to the oncologist. Now, if they recommend oncology consultation, it's up to you as a pet owner whether or not you want to pursue that. You don't have to, you're not automatically signing off onto chemotherapy or radiation therapy or anything like that. If you see the oncologist, you're only going for information. You're going to figure out from them what the current statistics are on this cancer, what's the prognosis, what are your options, what are the costs, the side effects, what are options if you don't want to do any of that stuff or whatever. And their job is to educate you, give you options, and then go from there. Now, it may be that their recommendations are additional testing. Maybe they're not entirely convinced your dog has cancer, or maybe the staging process wasn't completed to their desires by your family vet. Remember, these are oncologists; they're specialists. This is what they focus on, and they're going to have their own criteria for what they want in terms of diagnostics done before seeing them or before they can make further recommendations or pursue treatment with you or whatever it is. So, diagnostics and are going to be performed by your family vet, confirm a diagnosis of cancer or at least suspect it, then go to the oncologist. They're going to either say, yep, I saw your vet's records and you do have this cancer, and here are the details on it, here's the newest research on it. Or they're going to say, I'm not entirely sure, I'm not entirely convinced, we need more testing done. Let's do tests A, B, and C and figure it out from there. Then from there, depending on what you want to do as a pet owner, what you can afford, the pros and cons, you can either pursue what they want you to do or not. Let's say you've already done the testing, whether it's at your vet only or your vet and the oncologist, and you confirm cancer, and now the oncologist says you have options for additional surgery, radiation therapy, chemotherapy, metronomic therapy, which is a low-grade level of chemotherapy given chronically for dogs, any other palliative care, so things like pain medication, supplements, nutritional advice, etc. They're going to give you through all these options for you, and you can decide what sits best for you. They'll have kind of the ideal scenario where money wasn't a concern and you were do it all kind of people. This is what we would typically recommend, but here are some permutations in case you don't want to do all that. So from there, what will happen is you'll schedule whatever it is that they want you to do, if you want to do any of it, and not every oncologist at this point is going to be the same. So there's medical oncologists who focus on the chemo side and other medications, the medical side. And then there's radiation oncologists, which focus on the radiation therapy. I'm not familiar with whether or not you can have an oncologist that is specialized in both, but the vast majority of oncologists are doing one or the other. They're not doing both. And so because of that, they're going to either refer you to another oncologist, or they're going to have you stay with them, whatever their abilities are with your decision. And then from there, you'll have a long-term relationship with the oncologist, with the attempt of either curing your pet or buying as much quality of life time as you possibly can until the cancer catches up to your pet. intermittently, you can follow up with your family veterinarian depending on what the oncologist wants, because some treatments like chemotherapy, for example, require periodic blood work. So whether that blood work is done with the oncologist or your family vet depends on you and your location. If you're visiting an oncologist who's 2 or 3 hours away from you, it may not be realistic to visit them every week or whatever for blood work. And then in that case, maybe your family vet would run the blood work that the oncologist wants, interpret the blood work, send it to the oncologist if it's a concern, and then consult that way. Or you'll visit the oncologist every time they need to see you for something. And then the treatment duration depends on chemo, radiation, surgery, whatever, and what your oncologist wants to do, what you can afford, and then of course the how the patient is responding to it. A patient who's having side effects and stuff may visit the vet a lot more often than one who is not. So it all depends. With cancer patients, it's quite variable. Every situation is fairly unique. Not every test is done for every animal with the same cancer. It's all circumstantial, and so you have to just defer to the opinion of your oncologist, and then figure out from there within your own ethical and financial and moral guidelines, etc., what it is you want to do with your pet. So yeah, so that's the gist of it. All the records from your oncologist typically is shared with your family veterinarian, so your family veterinarian will know what you guys talked about, and be kept in the loop. So yeah, so I think folks will find oncologists to be very personable. They are quite thorough. They are very intense about their craft, which is a good thing to have. So the majority of oncologists that I've met, probably all of them actually, to think about it, have been awesome people. And of course, you'll grow to be very bonded with your oncologist because it's a very sensitive topic. You have an older pet, they probably have multiple diseases, now they have cancer, and it's going to be this back and forth, and you'll get pretty attached to them. So yeah, and so that's the gist of that for veterinary oncology. Anybody have any questions, let me know. Thanks for those who watch us on the playback. Feel free to subscribe, like, share, donate, do all those things. And I'll see you tomorrow, Sunday, August 4th, for another live stream. Take care.